So good afternoon, everyone, and greetings from Manchester, or rather the Yorkshire Dales, from where I'm fortunate enough to be working at the moment. So I have the great pleasure and privilege of being the Head of Health Sciences and Vice Dean of the Faculty of Biology, Medicine and Health at the University of Manchester. And the Division of Population Health, who've been organising this fabulous conference, sits within my school. And I was delighted and honoured when Professor Verma invited me to say a few words this week, not least because the webinar speakers have all been fabulous. And as an academic, one of the key learning objectives I always hope to achieve when I teach is that of stimulating the listener to think. And I hope that the series of webinars that we've brought to the thousands of you joining us this week have done just that. There certainly have been plenty of tweets, and judging by the questions the last speaker received, it really has worked. Everybody has been thinking. And just to reassure you, I'm not going to take up much of your time, as I'll follow the advice of Franklin D. Roosevelt, who said, be sincere, be brief, and be seated. Although as healthcare professionals, I guess we'd take issue with the latter. I'm very grateful to my school team for organising this event, which has gone out over the last few days as part of our contribution to European Public Health Week. It's fitting that the theme of the week is joining forces for healthier populations, as the team have pulled together an array of expert speakers from around the world. Indeed, many of my colleagues who've been taking part from the University of Manchester are representative of all the speakers in that they come from different backgrounds and from different disciplines. And to me, this seems to sum up the holistic and multidisciplinary nature of public health. It also chimes with Ethos 3 of the European Public Health Association, in which the training and education of new public health professionals is featured. As I know from talking to students who are on or who are alumni of our Masters in Public Health programme, they are not just from different countries and have different nationalities, but also different educational backgrounds. And we need this richness as we build capacity and increase reach to fulfill the goal of improving everyone's health and well-being. Public health practitioners and educators have never been as important and as needed as they are in this moment of time. The voice of public health experts needs not only to be heard, but understood by everyone, especially those who formulate health policy. The evidence base that is growing during this pandemic has to be employed to ensure that the learning we take from it is not forgotten, but readily deployed to prevent the next time. So finally, all I can say is stay safe wherever you are and keep up the great work. The world needs good people doing good work, generating strong evidence and listening and learning from it more than ever. Thank you, especially those of you who've been getting up in the middle of the night to join us. Goodbye.